Hi, I'm Dr. Nixon, and welcome to Healing Peak, Regenerative Medicine's Longevity channel. And today I want to share with you a case study. In the past few weeks, we've talked about what we call, or what I call, foundations of health, which is taking care of your body from the foundational level and then allowing it to have a platform where it can function its best and has all the building blocks it needs to recreate connective tissues, which are essentially all your skin, your joints, your cartilage, all your hair, nails, all those things. It also puts your body into an anti-inflammatory state, which will decrease pain and decrease the possibility of any kind of chronic pathological issue like diabetes, cardiovascular disease, cancer, those types of things. But today I want to share with you a specific story. I was working with a woman for a couple of years. Actually, she came in at first a year ago or a year and a half ago and needed some hormone balancing, but also was complaining of hip pain. And we looked at her hormones, and she had had some struggles with adrenal fatigue in the past and didn't really want that treated. So we worked on her thyroid, and to make the story short, She left for another year, came back still frustrated, feeling a lot of fatigue. I mean, really pretty, couldn't get out of bed, had very low energy, but also a really high stress job. She didn't have time to be sitting around for 10 hours being tired. And so we started working on her hormones again. We ran a saliva hormone panel and found some discrepancies with her hormones and started to treat from there. She has improved dramatically with her hormone profile and also just her quality of life, able to handle her stressful job a lot more. She's 60 years old, and at the time I said, I know you have hip pain, but we can't treat that until we get all these other things that are an issue under control, because when we start to use regenerative medicine and prolotherapy, PRP, we really need your body in this really healthy state in order for those injections to work. And so we were working on those for a good 6 months prior to doing any kind of injection therapy. The hip pain she was having was on both sides, and one side was a little bit worse than the other. And sometimes she would be standing to wash dishes, and her hip would just give out from underneath her in excruciating pain. She'd been worked up by an orthopedist. They told her that she had arthritic hips and that she would need cortisone injections, and eventually she would need joint replacement therapy. And in May of this year, she's going on a trip, and she needs to be able to ride a bicycle, and she needs to be able to ride it for long distances. And she's been looking forward to this trip for a really long time, and came back and said, hey, can we do these injections now? Because I really want to be able to ride my bike on this trip, and I want to be able to move, and I want to be able to walk and experience things with my friends. And she's kind of getting closer to retirement age. And I said, okay, yeah, let's look at everything. We decided to do the injections. I first did prolotherapy on one hip. That was very successful. And then we moved to platelet-rich plasma on that same hip and prolotherapy on her other hip. And after 2 injections on the hip that was not the worst hip, and 1 injection on the other hip, her pain is now 95% better. She's able to cycle. She does have soreness after cycling. Of course she does, because she's working out in a capacity she wasn't able to work out before. So she's now building structure and strength around those hips that we've injected. And it's a really incredible story, because what the orthopedist gave her as options were essentially cortisone therapy, which just degrades the entire joint, breaks it all down, and then eventually a joint replacement surgery. I mean, what would have happened is her quality of life would have suffered long term. Probably her blood sugars would have gone up because she wouldn't have been able to exercise the way that she can exercise now. She's also osteopenic, meaning that her bones are not as dense as they need to be or as they once were. And that's the step before osteoporosis. It takes a long time. Likely that's not going to happen. She's a very healthy person. And now, because she can do all these exercises, that's the number one thing that you could do for osteopenic bones is weight-bearing exercise. And so she's going to be able to sustain her bone density because she was able to get these regenerative injection therapies. I do screening on all my patients prior to these injections, and this is why. Because if I wouldn't have done that, number one, the PRP and prolotherapy may not have worked. And number two, if it would have worked, she probably would have needed quite a few more rounds of these therapies in order to have the results that she had. And so I've shared a lot with you about foundations of health, about what you can do on a daily basis to make sure that things are functioning optimally in your body. But what do you do when you're doing all those things and you still are experiencing some type of pain, or you're not getting that healthy glow back to your skin, or your hair is still not, growing in the way you want it to? There's some extra steps that you can start to take, like getting your hormones checked, or initiating a consultation for regenerative injection therapies, which is prolotherapy and platelet-rich plasma therapy. And I will eventually go into what these are and how they work, but I want you to get excited about them because they're incredible therapies. And what is typically offered, from an orthopedic doctor is really not a good long-term solution. I mean, to be totally frank. And it's great that we have them for certain instances. We really need that kind of medicine, but the majority of the population would do much better with lifestyle care, which is what I have repeatedly told you I talked about in the other videos, and then also with these types of therapies that build the body up instead of break the body down, and also improve quality of life long term so that the body can continue to function the way that it's supposed to. So that's all for this week. Thank you for joining us. If you like these videos, please subscribe to my channel. And you can also follow me on Instagram at Dr. Amber Nixon. That's my handle. I would love to see you there. And I'm posting daily tips and things, a lot of amazing content on there as well if you would like to see some more from me. All right, thanks so much. Have a great week.